There's a lot of reference to the term the opioid epidemic, and we're seeing it more and more. But has this always been the case?
You know, at different parts in our society and in our history, there's been opioid epidemics. We had the opium wars years ago with China,
Right.
But in the early 1900s, we had a real rash of opium. But then it was more the women, and they were at home, so nobody really talked about it, you know. In the late 90s, Pardue Pharmacy introduced Oxycodone,
Right.
and that's a highly addictive drug, and there was some really powerful marketing around that. We introduced pain as the fifth vital sign. You know, we really did a lot looking at people don't need pain, and what our society said is, okay, so we'll give you the opioids for the pain versus looking at some other things, and what we ended up with was this opiate epidemic.
And now we're seeing it more and more.
We are.
Currently. Now, let's go through the list that you call the drug trifecta. We have opioids, alcohol, and benzos. What is this drug trifecta?
We see that these depressants active in a lot of the overdoses. So while, you know, the focus on our society is with the opioid epidemic, and that's true, but with the opioid overdoses, a third of them have benzodiazepines with them. They're using benzodiazepines in their system.
Explain what are the benzos. Are we talking about the Xanax and?
Yes, mainly they're the anxiety pills,
Okay.
things that help with that anxiety, but they're also sleeping pills, the
Okay.
benzos.
Okay.
So they kind of slow you down a little bit, and then you have the opiates, which slow you down. So about a third of the overdoses have the benzos with them, and then over about 25% of the overdoses have the alcohol with them, and then there's others that have all three. So we see that trifecta a lot. And the reason that's so risky, mixing any of them, and if you take a benzo or an opioid, you'll see on the bottle, don't mix this with alcohol. The reason for that is because both are depressants, so they slow down your respiratory system and people die.